For right now, though, I want to do a little political science research, and I thought we would visit Prager University.
America is sick and getting sicker by the moment. Is it any wonder then that healthcare costs continue to surge out of control, outpacing every other sector of the economy? 17 cents of every dollar spent in the US goes to healthcare. That's 1/6 of all spending. 48% of all federal spending is related to healthcare. Not surprisingly, as of 2018, healthcare became the biggest business in the country. And the killer, literally, is that we're not getting healthier. Why is that? Complex question. But we can boil it down to two things. One, we don't pay enough attention to our own health. Strange, our health is our greatest asset, and yet we often abuse it. We eat food that doesn't nourish, avoid basic exercise, and ignore sleep. Two, we doctors don't pay enough attention to basic patient needs. The healthcare system rewards us for doing things to people, not for people. The result? A very expensive system to treat the most obese, medicated, comorbid population in the world. Let's look at these problems a little more closely. Obesity. According to data from the National Health and Nutrition Survey, 2 in 3 adults were considered to be overweight or obese. That was in 2014. This is a serious problem in and of itself. According to a CDC study of the COVID pandemic, 78% of hospitalizations were among those overweight or obese. Overmedicated. 10 years ago, we doctors prescribed 2.4 billion drugs. Last year, it was nearly 5 billion. Did disease really double in the last 10 years? No. It's just easier to push pills than to push real solutions. Comorbidity. Let's take type 2 diabetes as our example. It's been rising at an alarming rate, especially among young people. According to the CDC, new cases are increasing at a rate of 4.8% per year. This disease can lead to harmful and expensive complications like heart attacks, kidney dialysis, and even amputations. Two groups are unhappy with how we treat these conditions: patients and doctors. Surveys show rising levels of patient dissatisfaction with the medical care they're receiving, while other surveys reveal rising rates of physician burnout. So what does the future look like? More sickness, more procedures, and more pills at an ever-increasing cost? Well, if we keep doing the same things that we've been doing that haven't worked for the last 25 years, the answer is yes. But that's the very definition of insanity. We need to take a fresh approach. It will require the combined efforts of two groups, patients and doctors. The best way not to become a patient is to be healthy. Healthy people rarely need pills or expensive surgery. Over 75% of healthcare costs go to chronic diseases. As a doctor, I can tell you the hard part about chronic disease is not telling people what to do.
Okay, let's pause this for a second. So, we tend to emphasize the negative here when we do PragerU videos, all the stuff that they're wrong about. But I do want to be even-handed here and give credit where credit's due. It is true that the best thing is just not to be sick.
It's amazing.
That's clearly better than being sick.
I actually love that quote. He was like, the best way not to be a patient is to not be sick.
Stands to reason.
He sounds like he has a doctorate in philosophy as well. I also have to say, Ben, usually you have us do this like when we're like drunk later in the post game, so we're very sober to be watching.
Yeah, this is a little. Yeah, this is kind of brutal being stone cold sober watching PragerU,
but we agree with him that there's a lot of problems in the healthcare system, right? That's what's so strange is they're talking about how we spend so much more money, but we have worse results. So
yeah, and it was a wonderful description of like how we're overworked at work, and he went through and beautifully described all the issues with capitalism in this description leading up here, but didn't say the words capitalism like.
Well, I mean, not only did he not say the word capitalism, I mean, there's no implication in here, at least not one that he seems to be aware of, that like economic inequality might be a problem that's related to anything that he's discussing, right? I mean, like, this is just all like, if you're individually more virtuous, then you won't get sick, and then you won't have to be a patient. Which, again, I mean, I've got to say, I mean, I wish I could find a flaw that, a little bit of reasoning there. But I mean, like if you don't get sick, then you don't have to be a patient. Although, if patient means somebody who comes into the doctor for a checkup, then you actually legitimately do not have to be sick for that. And it seems to me, I mean, I'm a simple man. I'm not, I'm not a medical doctor. What do I know? But I was under the impression that it was good to like have preventative medicine, right? Like to go to the doctor when you're not actually sure that you're sick. Is that right?
I think that's how you don't be sick.
Yeah. Huh. So that might actually stop you from being the kind of patient that you need to be sick to be.
It could. I don't know. I mean, I guess we'll have to see. It seems like he's putting a lot of onus on the patients themselves, or there's some kind of collab that has to happen between.
It's like, how short is the patient's dress for the disease?
Exactly.
What was she wearing?
Yeah, no, exactly. Now it's confusing because this video is labeled "Healthcare is not a right," and it seems to me that at least some of what he's saying would indicate to me that he's talking about things that doctors should tell people that would be helpful, and fair enough. That there's some of what he's saying is right, but it seems to me that for your doctor to tell you the right things, you need to be going to see a doctor, and you're not going to see a doctor if you are worried about how you're going to afford it. So all this to me actually sounds like the wind up to an argument that healthcare is a right. So I want to see him blow our minds here by explaining, if we can get to this, before we have to do the next thing, why in fact healthcare is not a right.
That takes time. It's almost impossible to do in quick 10-minute office visits where doctors have to bill for everything they do. Again, the treatment of type 2 diabetes is an excellent example. It's a chronic disease for which people either take a medication or insulin injections. Yet most people with type 2 diabetes can come off their insulin simply by changing what they eat. When a disease can be cured by a lifestyle change, medication should be the last resort, not the first. This requires a partnership between doctor and patient. Both have to make a commitment to get to the underlying cause of disease rather than simply treat symptoms. Fortunately, there's a new wave of healthcare professionals who want to make this approach a reality. We're treating diabetes with cooking classes, not just insulin. We're treating more back pain with ice and stretching and physical therapy than just surgery alone. We're treating high blood pressure with healthy foods, yoga classes, stress management, and better sleep instead of just putting people on pills. I go into all of this in much more detail in my book, The Price We Pay: What Broke American Healthcare and How to Fix It. America has the finest healthcare system in the world, the most skilled doctors, the most advanced diagnostic and surgical techniques. It's there if you need it. The trick is to reduce the odds that you will need it. That's not your doctor's responsibility. That's not the government's responsibility. That's yours. We can have great healthcare, be healthy, and save billions of dollars. They're not mutually exclusive. It will take two groups to get it done: patients and doctors. I'm Dr. Marty Makary, professor of surgery and health policy at Johns Hopkins University for Prager University.
Okay. So that was this.
Why is it always my fucking alma? Well, sometimes he's just making me embarrassed to have anything to do with Johns Hopkins. I mean,
Well, look at the bright side. At least PragerU isn't your alma mater.
I feel like it is now after how much time I've spent watching PragerU's with Ben. Sorry, what were you going to say, Ben?
Yeah, some of us have done extensive postdoctoral work at Prager University. Yeah. Yeah. So that was a weird. So, is there supposed to be an argument in what we just watched that healthcare is not a right?
I couldn't find one. I mean, it almost seemed like he was arguing for a restructuring of society in a kind of socialist way where we could all hang out and cook together and do yoga classes together.
Yeah,
it sounds pretty good.
Yeah, I mean, like, are these yoga classes and cooking classes, are they just available to everybody for free?
Well, so we talked about before how Prager usually tries to, and most of these figures try to go culture versus their economic argument, right? But here they're like, fuck it, we're going to do an hour on, it's like an hour-long marathon on convincing you that healthcare isn't a right. And what's funny is that I was looking at the comments, and the comments were so much more negative on this one than the classic Prager video. You know what I mean? Because like the other ones, like when they're just like, I'm not a liberal anymore, everyone's like, I love it. I love this content. But here, it's just, mostly like attracting people from the left. Yeah. But it's just strange because this is, all he said was at the end was, it's your fault. That was the only argument that we saw, was that like, we have these problems and we have the finest health. The doctors are not the problem. The system is not the problem. You are the problem.
Which is weird because it seemed like he spent most of the video saying that the doctors are the problem. Like that's what I heard. That they're giving people pills when they should be giving them yoga classes.
If you were a better patient, you wouldn't have taken all those pills from your doctor.
Yeah. When your doctor said you need these pills, you should have just said, nah, I don't think so.
You have the yoga classes for me to
we have these gullible patients who just believe everything that these doctors say. You know what I mean? It's like you can't trust everything these fine doctors say, who also constitute the best healthcare system in the world. As long as you know when to take them at their word and when to refuse their pill pushing.
Yeah, I also think that like the thing about I'm all in favor of universal state-sponsored, free at the point of service cooking classes. Let's do it. But I will even take what cooking skills I have and volunteer to teach you one. That's fine. I can, I've figured out how to make some like pretty passable enchiladas, I'll share my services with the community.
I'm happy to make my bougie grilled cheese class. I got one recipe and it is good, folks. Let me tell you.
Yeah, exactly.
I'm all about mutual aid. That's I'm on that side of the.
But like, I also don't necessarily think that the reason more people aren't, having home cooked food, like, yeah, there are plenty of people who like have never bothered to learn how to cook. That's true, but like, and they could, and they just haven't bothered to, and that certainly exists. But like, seems to me there are an awful lot of people who, by the time you get home from your second job, you are fucking exhausted, and you want to either order something or heat something up, and that is about all you have the energy to do. And that seems like an economic problem. And also like, okay, look, if we have the great, like what he means when he says we have the greatest healthcare system in the world is that if you can afford it, we have it, right? But like that's kind of like saying like to a homeless guy, that it's like if they're like, like sleep, like, hey, 3 blocks away, they're the nicest, mansions in the world. It's on you if you're not living in one. You have been watching free public content from Give Them an Argument. To access every single episode of the show, the main show on Monday nights, all of the streams, all of the debate breakdowns, all of the patron-exclusive post-games on Monday nights, all of the patron-exclusive bonus episodes every week, and much, much more, go to patreon.com/Ben Burgis. I cannot resist ending this with, don't be foolish.